The prostate is part of the male reproductive system. Cancer of the prostate is one of the biggest health issues facing Australian men. Australia has one of the highest rates of the disease internationally. Reasons for this include our high rates of testing for prostate cancer and the simple fact that we have a long life expectancy in this country. Family or genetic risk also has something to do with it, and increasingly we know that poor lifestyle factors are putting men at greater risk of disease. This gives us even more reason to keep physically active and eat well. Make sure that your diet is low in processed foods and high in fruit and vegetables, and try to replace red meat with white meat when possible. If you're unsure whether you should be tested by your GP for prostate cancer, there are Australian guidelines to help you make an informed decision. In a nutshell, if you're a 45 or older and have a family history of prostate cancer, it's recommended that you're tested every 2 years. For men without a family history, it's recommended that you get a test from the age of 50 to 69 every 2 years as well. And if you're 70 or over, testing is not recommended, as you're more likely to be affected by other health problems, and even if you do have prostate cancer, you're probably going to die of something else. Having said all of that, men of any age who are having any symptoms, such as difficulty passing urine, shouldn't delay seeing their GP. So, what does testing involve? Well, you'll be pleased to hear that the digital rectal exam, which involves your doctor inserting a gloved finger up your bum to feel for an enlarged prostate, is no longer recommended as part of the routine screening for prostate cancer by your GP. This puts a lot of men more at ease straight away. Instead, a blood test, called the PSA test, is used. PSA stands for prostate-specific antigen, which is a protein that's released by the prostate and which plays an important role in liquefying sperm. Normal blood levels of PSA are very low, but as you age, and if your prostate is inflamed or unhealthy, it will release more PSA. In other words, if you have a high PSA reading, it doesn't necessarily mean that you have prostate cancer. However, if you have repeated high PSA readings, or if your PSA is rising more rapidly than expected, your GP will refer you to a urologist because you might have cancer. Your urologist will probably give you an MRI scan of your prostate, possibly a digital rectal exam since it can be useful in the specialist setting, and if these additional tests still indicate a possibility of cancer, you'll undergo a biopsy, which is the definitive method of diagnosis. There's been a lot of recent controversy over the PSA test because there is a lot of debate about whether the pros outweigh the cons. The main pro is that the PSA test is useful for detecting prostate cancer early when it's confined to the prostate. Early detection obviously results in an opportunity to commence early treatment and a better chance for a cure. Another pro of the PSA test is simply reassurance. If the PSA test result is normal or very low, this will often provide peace of mind. However, a major problem with the PSA test is that it isn't all that accurate. It can predict cancer when there is none, and it can also miss cancers. For this reason, scientists such as myself are trying to find better tests to replace or be used in combination with PSA. But it's important to note that it's the best test that we have at the moment. Another issue with the PSA test is that it often diagnoses prostate cancers that are small and slow growing, which, in many cases, won't affect a man's quality or length of life. However, because it's hard to say with certainty that a tumour isn't going to be life-threatening, many of these small and slow-growing tumours are treated. And treatment can cause unpleasant side effects like erectile dysfunction and urinary problems. The sad truth is that many such men could have avoided treatment and lived a completely normal life without any problems from their cancer. Again, scientists such as myself are working on tests that will better predict disease aggressiveness without men having to go under the knife. So, some take-home messages from this video. First, if you aren't having symptoms, the decision to be tested is a personal one, and you need to know the pros and cons of testing. Second, you probably won't get the finger, and if your GP offers it, perhaps discuss the guidelines with him or just ask for the PSA test. Finally, keep paying attention to physical activity and healthy eating guidelines, as these are important to both prevent cancer but also improve outcomes after cancer treatment.